Hi, my name is Dr. Shouka. I'm here in Tustin, California, and I'm a chiropractor. I also do a lot of clinical nutrition with my patients. Oftentimes they ask me what supplements they should take, or when to take them, or how to take them for their nutritional needs. I find that there's so much out there. It can be confusing for people. The problem with the supplement industry is that it's not regulated, and so you can be there's a really good example of buyer beware. You could go to any health food store and potentially buy something that's good for you, bad for you, or is neither good or bad for you. So pretty much from my opinion is that you probably get about a 1/3 chance of getting the right supplement. Now, let alone just getting the right supplement, and getting the right supplement for your needs is another challenge too. Anyways, I'd like to pick a few supplements here and tell you a little bit about them, how we use them in the practice. One thing that's really of concern to many folks is stress and stress management. So I use these supplements, 5-HTP. You might have heard of those. 5-HTP is 5-hydroxytryptophan, and it's a precursor to serotonin in your body. Serotonin is the neurotransmitter that lets you feel that everything is okay, everything's going to be fine. If you are low in serotonin, then you are susceptible to anxiety and nervousness. If you have enough serotonin, you would feel like everything will be okay. 5-HTP is used in your body to make serotonin and melatonin, and melatonin is the neurotransmitter that lets you sleep. Most of you may have heard of melatonin for if you've been traveling, you want to get back on your sleep rhythm, you can use melatonin, or you can use melatonin to get a good night's sleep. But the main point is that you're affecting your neurotransmitters. There are many medications that affect neurotransmitters, and they're used to modulate stress, anxiety, and also pain. There's a commercial on TV. You might recognize it as they tell you that, who does depression hurt, and where does depression hurt, and they say it hurts everyone and everywhere. So this is not necessarily a treatment for depression, but if your body is deficient in certain nutrients, it doesn't have a chance to produce those neurotransmitters. It's as simple as that. The way that medications work is that the neurotransmitters are secreted and then they're reabsorbed. And so the medications, most of them, block the reabsorption. So eventually, as your body secretes more and more of, let's say, serotonin, and it doesn't reabsorb it, there'll be enough in your bloodstream or in your blood chemistry, brain chemistry, that will give you a saturation rate of the serotonin. That's why it's important, if you are on medications, that you have your prescriber, your medical doctor who's prescribed you the medication, that if you are going to be taking medicine or coming off of medicine, that you have to let them be aware of that. My approach is just to substantiate the foundation. So in other words, if your body is deficient in the nutritional precursors to these neurotransmitters, in this case, if it's deficient in 5-HTP, and we provide that, your body has a chance to make serotonin, and that could resolve a lot of issues for many people. Another nutritional precursor that I like to use in the office is called tyrosine. Tyrosine is the nutritional precursor to dopamine and norepinephrine. Norepinephrine is what your body uses to make energy, and dopamine is what your brain needs to have motivation. So you have people that can be feeling down or sad, or they can be manic, and all of these have a connection with how much dopamine is running in their body. The way I recommend these with people that are in need of nutrition for their brain chemistry is that if you're feeling anxious, if you're feeling nervous, if you are you feel like, you know, there's more happening than in the world than that you can handle. If your body has enough of this 5-HTP, it'll produce more serotonin, and it'll make you feel a little bit better. Now, the tyrosine is for dopamine, norepinephrine, so that would be with, let's say, I always use this example of the couch potato. Somebody that's just unable to get motivated, unable to just get out there and do things, chances are they might be low on dopamine and L-tyrosine. You know, you can check your biochemistry books, and it'll tell you what that's the precursor to dopamine. And so, if your body knows how to make it, just give it enough of the raw materials, and it'll make it. Now, there's another neurotransmitter that I'm interested in too, and I use glutamine to impact that neurotransmitter. Now, that neurotransmitter is called GABA, gamma-aminobutyric acid, and what GABA does is it suppresses the nervous system a little bit. So if you have too much excitation, and if your brain is rushing from one thought to the next, to the next, to the next, and you're unable to slow down, try taking a little bit of some glutamine, and that'll help your body to produce more GABA. And by producing more GABA, you'll be able to have an inhibitory effect on a racing mind. So the three nutritional precursors are 5-HTP, tyrosine, and L-glutamine. And here's how you know when you need it. If you're feeling nervous or anxious, you can try some 5-HTP, and that'll probably help you with a lot of that anxiety. If you're feeling maybe sad or depressed and unable to get motivated, then you probably want to increase your dopamine a little bit, and that would be with the L-tyrosine. And if your mind is racing, you try to put your head to sleep and your mind is racing, you can't stop your thinking, then you might want to increase your GABA, and you can take a supplement like glutamine. These three supplements that I use in the office are proteins. They're amino acids, and they occur in nature. They're just, you know, part of our diet. But when we take it to clinical doses, in clinical doses like this, you can get a benefit from it, and you can get a good use out of it. And I have many patients that use that, and occasionally I use those myself whenever I feel any of these conditions. If I feel that I'm not motivated enough, I would just increase my tyrosine a little bit. If I'm feeling anxious or nervous, I could increase my 5-HTP. And if my mind is racing and I can't slow it down, I would use something like glutamine to increase my GABA, gamma-aminobutyric acid. So many medications are using these mechanisms where they're altering the neurotransmitters in the body. And with that, they're using it for people with chronic fatigue. They're using those kind of medications with people that are achy, tired all the time, unable to be motivated, depressed people. Definitely, if you have any of these conditions, you should check with your doctor and get those managed. But at the same time, you can also do something nutritional that you can benefit from. And we've had patients that started the nutritional program and needed to taper down on their medications, and they were able to do that with their medical provider. So these nutrients are really very interesting, and it's amazing that we can have an impact on our mood and our energy by affecting these neurotransmitters. So it's one part of my nutritional recommendations that I really like. And let me see if I can pick something else that might be of interest. Here's a supplement that I use a lot in my practice. It's called Siberian root. Siberian root is also known as Siberian ginseng. It's not a ginseng, but it's a relative of the ginseng family. What I like about it is it's that it's an adaptogenic herb. In other words, whatever stress or condition or illness that your body's going through, if you take an adaptogenic herb, it's an herb that allows you to cope with any type of stress. So something like Siberian root is really nice to use with my patients because it doesn't have the restrictions that certain ginsengs have, and it's very safe to use. And for just across the board, for any type of stress, people can take that Siberian root and get a lot of benefit out of it. It also has an impact on the immune system. It has some immune modulators in it that help to rebuild and strengthen your immune system. And it helps support your adrenal system. And so what happens if you've been under a lot of stress for a long time, your adrenal system will be suppressed, and it may be difficult to come out of it so quickly. But if you have an herb like that, it can really support you and get you out of it fairly quickly. So it's Siberian root. It's good for your immune system. It's good for stress, and it's good for energy. A lot of times, when people are using, when they are needing Siberian root, it really has to do with a deficiency they have somewhere else. And let me pull this out. And this is one of the supplements I use. It's called Thyroid, and it's a supplement for thyroid function. Now this is so interesting to me because there are so many people walking around with undiagnosed or underdiagnosed thyroid conditions. They have their blood tests and everything comes out normal, but yet they still have symptoms of thyroid. So let me review a few of the symptoms of thyroid, starting from the head down. First of all, when you look at the hair, in somebody that's thyroid deficient, the hair loses its luster. And an easy way for you to learn how to recognize that is if you look at children, you can see their hair being very shiny, and it has a luster and shine to it and health to it. And if you look at people that are deficient in thyroid, you'll see a loss of that hair, a loss of that luster in that hair. The hair gets weaker, and it gets thinner too. So the actual hair will become coarse, but the amount of hair that's there will decrease. And so a big reason that for hair falling out and getting weaker and losing its shine is that the thyroid is weak. The other thing that would happen is that brain function is affected. Well, first of all, your whole body has thyroid hormone receptors on it, so it's going to affect your whole body. But the brain function is affected. So people with low thyroid, their thinking becomes sluggish, their ability to recall is less, and they'll recognize that, hey, you know what, they're not as sharp as what they used to be. And that could be a good sign or indicator that the thyroid is not working at its optimal. The other thing is that thyroid controls body temperature. And so people with thyroid will be the first ones to feel cold in the room. So if you're one of those people that tends to feel cold before everybody else, there's a good chance that you may have thyroid deficiency. And of course, if you have any swelling or lobules on your thyroid, then that's obvious that there's something going wrong in the thyroid. As we work our way down through the body, the thyroid gland is the main gland that supports and bolsters the heart function. So if the thyroid function is low, the heart is going to suffer from that. And it's very critical that you keep your thyroid function up to keep your heart and cardiovascular working properly. As we work our way down, the digestive system is huge. Many people with thyroid problems have sluggishness and constipation in their digestive tract. What's so funny is sometimes people will say, oh, I don't have any constipation, but what I do have is diarrhea. And so in the nutritional field, we look at diarrhea as another form of constipation. What happens with severe constipation is you have plaquing and impaction all around the lumen or the insides of the intestinal tract. And because of that, the food, you can develop a diarrhea where things just go through without even being absorbed or digested. What else? You can talk about with the thyroid is skin. Makes skin the skin will get a rougher texture, won't be as healthy looking, and so what happens is when you have those are so we listed a whole bunch of basic symptoms. I think the nails also will become brittle too. They're easy to check. You can Google thyroid symptoms, and you can go through them yourself. They're easy to check, and they're obvious to see. I had a great experience one time. I was over at one of my friend's offices, and she is a medical doctor, and she is chief of staff at the hospital. She had a beautiful poster. The poster showed all of these symptoms of thyroid deficiency. The tiredness, the hair, all the things that I talked about were beautifully depicted on her poster. I'd like to get one of those for the office soon. But anyways, so I asked her, I said, do you ever have patients that have these symptoms, but their blood test is normal? And she says, oh, all the time. And I said, well, what do you do for them? And she said, nothing. Because medically there's no indication. So do you see, when you go to your medical doctor, they're going to look at the indications, and the indications are the blood work. See, that's the standard of practice. So if the standard of practice says that you don't have a thyroid condition, but all your signs and symptoms say you have a thyroid condition, well, then it's up to that doctor to override the standard of care or to use their own clinical judgment. And when it comes to medicine and medications, I think maybe they need to protect themselves in terms of what they recommend or don't recommend. But you can safely take nutritional supplements. And if you have all of these symptoms and your blood work is normal, you can try a simple course of a supplement like Thyrosol or a good thyroid based nutritional product that will strengthen your thyroid, and you can see how you feel. Usually with the patients that I've done that with, they liked it. They felt better. And the reason I got into talking about the thyroid is that if the thyroid is low, what happens is your body starts to use the adrenal glands. So the adrenal glands have to work harder and harder. And that's when we talked about that Siberian route to rebuild the adrenal glands. So you have a condition, a situation where many people that have a thyroid condition are not being diagnosed properly. Their treatment options are not there through our standard medical paradigm, and their body is moving on to weaknesses in the adrenal gland, and then weaknesses in the pituitary gland. And really quick, I'll just say this briefly about the pituitary gland. The pituitary gland is a gland right in the center of our head that regulates all the other glands in our body. So if our thyroid function is low, our pituitary gland will send out TSH, thyroid stimulating hormone. And based on how much TSH is going on, it'll push our thyroid gland to produce more. And TSH is one of the main indicators that we look at on the blood work. So a lot of times, because the range on the thyroid is so wide, many doctors look at the TSH. And if they see a normal TSH, they think that your thyroid is normal. But the way it would work is that if your thyroid is low, your body would produce more TSH, so to speed up the thyroid function. But if the blood work shows us that it's not doing that, we can assume the thyroid is normal. But what do we do with all these people with the signs and symptoms of thyroid? And so I use nutrition for them. I use nutritional supplements, and they do well. They're happy. They can reverse all those signs and symptoms. Now, it's really important that when you're getting nutritional supplements that you get GMP certified, good manufacturing practices. And the supplements that I use in my office, they only sell through doctors and healthcare practitioners, and they're highly regulated. They use third-party companies to come and check on them, make sure that they have the quality of raw materials and ingredients. And I can rely on them. They've been around. Some of these companies have been around longer than I have. And most of them have been around longer than I have, so they have a long reputation and history for quality products, and I feel comfortable in recommending them to my patients. Anyways, if any of this stuff sounds interesting to you, or if you have any questions on possibly maybe there's some kind of a nutritional supplement combination that would suit you, suit your needs, or if you have any issues or questions regarding chiropractic care. And I've talked in my other videos about my approach to the chiropractic, where I focus on the scar tissue and resetting those, and you can just look up those other videos about the scar tissue. But anyways, my name is Dr. Shouka. I'm with ChiroActive Therapy, and we're in Tustin at 13691 Red Hill Avenue, and my phone number is 714-535-6535, and I'm losing my voice, so I'll catch you soon. Bye-bye.